Hello, and welcome to another episode of Your Health Matters with Sanford Health Marshfield Clinic. I'm your host, Laura Kibble. I'm so thrilled to have today with us Dr. Sam Klebe, our Chief Physician over the Marshfield Clinic region of Sanford Health. Thank you so much, Dr. Klebe, for being with us today. I really appreciate you taking some time.
No problem. Thank you, Laura, for having me.
Absolutely. So what type of physician are you?
So I'm an internal medicine physician. My specialty is in hospitalist. So I see patients in the hospital.
Okay.
I really enjoy that relationship, seeing patients go from being critically ill and then being able to discharge them and then connect with their primary care physician.
Yes, excellent. But your title is Chief Physician. So what does that mean? I'm not sure that anybody really, we've heard chief physicians. What is your role and what do you oversee?
Absolutely. So prior with Marshfield Clinic, I was the chief medical officer, and I think people are more familiar with that term. That's usually with recruitment, policies, medical staff bylaws. My role as chief physician today is more honed in on recruitment, retention, and operations for physicians and APCs.
Okay. Did you know you always wanted to go into leadership, or was this something that you kind of learned that you were interested in as you went on your medical journey?
I don't think any physician really states that they wanted to be in leadership.
Yeah.
I think it's a natural progression of what happens over time. So for me, I actually did leadership in my chief year as internal medicine. So I was chief resident.
Okay.
Subsequent to that, I had a really great advisor that said, Sam, I really think you have the skill set to be in leadership. I didn't think so, but she helped me do a chairmanship in my department. Subsequent to that, I was a floor director in our large hospital and then had become a medical director after that. I think what's really, really unique about being a physician leader is that you enjoy the relationship with your patients one-to-one. Being a physician leader lets you allow to have that one-to-one interaction and impact go from 1 to 1,000. You can really make a change in patients' lives. So this is an extension, really, of that one-to-one relationship. So while I didn't choose it, I really enjoy it, and it allows me to still do that.
Wonderful. And are you still a practicing physician?
I am. I will be working this weekend and 2 weekends ago.
Oh, wow.
So I practice monthly. I do anywhere from 2 to 4 days a month.
Okay.
I practice at a hospital over in our Weston Hospital.
Wonderful.
Yeah.
I don't know how you do it because I know you're incredibly busy, and how you still find time to serve our patients is very commendable, particularly on a weekend when most people need that to recharge and rejuvenate. So I know you're very dedicated to our patients, and I thank you for that.
Absolutely. No one argues with me to take their weekends, so it's an easy shift to get.
I bet. That's wonderful. So I can't believe it. It's almost been a year that we've been doing Your Health Matters with Marshfield Clinic, and I have enjoyed every episode and getting to know our physicians better and the amazing work that they do. My first guest was Dr. Brian Horniman, who is our president and CEO of Sanford Health Marshfield Clinic, and he told us about the integration with Sanford and what that was going to look like and what we had to look forward to. And a year has come and gone, and I would just love to hear from you as our chief physician. What has happened over this last year, particularly with our physicians in recruitment and retention, as well as our patient experience and the quality that we provide our patients? What has changed? What has improved? Any insight on the last year would be wonderful for you to share with us.
Absolutely. The last year has felt like a whirlwind.
Yes.
In the midst of it, it feels like it's taking a really long time, but as I look back, the last year has already gone by very quickly. So one of the first things that we had to do in the physician leadership group was to really redevelop what our leadership structure looked like. We used to have centralized leadership positions, meaning 1 to 12 physicians really were helping to navigate and dictate the physician realm. As we have integrated with Sanford, we're looking more for boots on the ground leadership from our physicians. Those that are in those subspecialty care, we want them to stand up and help develop their department, to help grow for retention and recruitment. So we have gone from really 12 to 13 physicians that we're leading and navigating to 61 chairs.
Wow.
So you can imagine this was quite the endeavor. Not only did we set up local leadership, which we called chairs, we also set up those higher level regional leadership, so what's called chief of service. So for the chief of service, we have 13 in total. They serve on our Physician Executive Council, and what happens is they help us navigate and look at what are the things that we want to do in the future state for our physicians and APCs. What is the direction that we want to do with our care plans? What is the newest standard of care? Are we bringing the best to our patients? Those 13 physicians serve in that realm, and they serve the whole region. Then for the chairs, the 61 that we have today, they're going to serve more locally. What does the day-to-day look like? How does the schedule look? How do we bring patients in? How do I recruit a new partner? So not only have we expanded our leadership, we've really kind of subdivided it into regional leadership, then your local leadership, and then really excited to have future leadership. One of the things that our physicians and APCs expressed was, I'm looking to get into leadership, but I'm not sure how to do that. How do you go from being a frontline physician or APC into a leader? It's not always natural, like we talked about.
Right.
So we were able to have our physicians and APCs apply to the RISES program, which is a leadership academy. It's a 2-year leadership academy with Sanford Health. Within the first 3 months of our integration, we were allowed to have that happen, and I'm very thankful for that as well. For our physicians and APCs that applied, it was really difficult to get into the program. Over 130 people from all of the regions of Sanford had applied, and we were lucky to have 5 of our own. So 3 of them originating from our Marshfield main campus, both physicians and APCs, and we're very proud of them. They are working on their capstone project right now, which is about patient experience. So really honing in their leadership very selectively to what they do day to day and how do we impact our patients there. So that sounds very small, but was a very large portion of what had happened. So that is our leadership and kind of governance structure. On top of that, the operations have changed as well. So our physicians and our APCs participating at the local level to help make sure that their operations. We've had new operational leaders as well, so developing those relationships and really looking at strategy in the long term. While we were doing all of that, we couldn't stop recruiting. So really getting our physicians and APCs in the boat of helping us with our recruitment. One of the things that we've heard from both our patients and our providers is we need more people. I haven't been able to get in to see X, Y, or Z doctor, or I've had to travel a really long distance to see this subspecialist. And one of the things that I think that we offer here is that subspecialty care here in your backyard. So last year was a recruitment, I will say, behemoth. We had recruited and onboarded over 123 providers, half of those being physicians, half of those being APCs. For our physician counterparts, for primary care, we recruited over 30 people.
Wow.
That was the largest that we've ever recruited to. Recruiting in rural America, especially here in Wisconsin, can be really difficult. Less than 3% of physicians will consider to work in rural healthcare. And I think sometimes we use that word rural a little bit too loosely because we not only serve rural, but the super rural. Rural can be defined as being an hour and an hour and a half outside of a major city. We're clearly more super rural than we are that. So bringing people in and then growing our own. We can recruit people here, and we've had a long-standing tradition of that. The other thing we did was try to expand and look at our GME program. So that's graduate medical education. These are programs where we are developing and teaching doctors for the future, whether that be residency programs or fellowships. In the midst of our integration, we did stand up vascular surgery as a new fellowship program. We expanded our cardiovascular fellowship program, and we've also expanded some of our residency programs like internal medicine. So not only are we recruiting here, but we're developing our own. We know that 60 to 70% of the people that we train will remain within 60 miles of where they train. So we want to make sure that we're teaching and training the best and brightest, but also bringing in the best and brightest. I think one of the highlights that people don't quite know is that the folks that we've recruited here are from top training programs. I've mentioned this before. The dermatologist that we have recruited in the next couple of months comes from the #1 program in the United States.
Wow.
Our MFM are from Cleveland Clinic. Our cardiologists are from Johns Hopkins. You have the best training right here at your back door. So very excited to have them be a part of our group, but also the offerings. These folks are bringing new novel technologies. Over the last year, we have been first in state for several things. So I think that's been really exciting to have that here in our back door. So we've done governance, we've done recruitment, we're expanding our programs. It has been a whirlwind of the last year.
It really has. And I have to say so much of that really is your incredible work in recruitment. It's not easy to also, Marshfield Clinic kind of going under that Sanford umbrella. There's a tremendous amount of work that goes with that. But I think, the amount and the number of recruits that we've had has just been outstanding. And I do feel like people feel like they're, Sanford Health, this is a huge health system. There's a lot of opportunity. And we know that Marshfield Clinic provides tremendous opportunity for our physicians and our APCs to grow and learn through our research foundation, through fellowships, through residency. It's just a wonderful place to become the highest type of physician that you want to be, which is really outstanding. Shifting a little bit to patient experience and quality, and you mentioned, Capstone focusing on patient experience. That's incredibly important to us and to every patient, that they have the best experience possible and the highest quality experience as well. Can you tell me a little bit of what we've done over the last year to focus on patient experience and the quality of care that we provide our patients?
Absolutely. I think the foundation of this is listening.
Yes.
What is good experience for you versus me can be very different. So some of our patients have said, we would really like to have an online platform so that we can make our appointments, because that's the best way that I want to do that. So over the last year or so, we have really developed our online scheduling. We have worked with our providers to say, patients are really looking for online scheduling. Can we work with you to help build that out? Primary care was a great partner in this, and so was behavioral health. So having that leverage to work with, one, to listen to our patients, to say, I'm not looking to call in, but I want to do it online, and then working with our providers to make sure that we can do that, and all the people in between, IT, operations, everyone who makes that available. The other thing is that we didn't always share the patient experience results with our providers. We would know what they are, but the provider didn't get to see the totality of care. Maybe they knew that the communication between themselves and the patient went extremely well, but maybe the food wasn't quite right. Maybe the introduction didn't go as planned. So we want the physicians and APCs to see what is that total spectrum of care, not just your singular piece. And then having the meetings, as you know, our operational partners have brought the patient experience to our meetings to say, how do we as a team, from the check-in to the physician and APCs to check out, how does that experience, how is that impacted by each of us, and how do we work as a team to make sure that we mitigate any negative experience that our patients have? How do we help them find the next best option for them if that's what they need? So I think really listening, taking that to heart, talking with every portion of the care team to say we are ultimately responsible as a team.
Right.
No one individual is going to make or break this, but each of us working together can lift this. So we have done a ton of work in our patient experience realm, both in the ambulatory when you're checking in and seeing your doctor outpatient, and also the inpatient. For the inpatient perspective, we have done a ton of rounding, and I know people hear that. So our leadership team, especially the nursing leadership team, has taken on themselves to do rounding with patients, to come by to say, how are things going? Is your food okay? How are you able to sleep at night? So not only is your physician and nurse who directly take care of you making sure that things are going well, we have our leadership team coming to the front line and asking the same exact questions. If you are saying, I'm getting asked too many times, we are succeeding here.
Right.
So we want to make sure, again, that the patient experience that they have personal to them is what they're looking for. We know that healthcare is already extremely difficult. Understanding new language, being in foreign environments, it's already stressful enough. If we can take that burden off of you to understand, how do you best understand directions? Is that in printed form? Is that verbally? Do we need to have one of your family members here to go over that? That way that they can have great healthcare and that they can follow up as well.
Yeah, I couldn't agree with you more, and I would say over the last year, we've put so much emphasis, and we will continue to do so, on the patient experience and quality. And as a consumer myself, I'm noticing a difference. I absolutely love being able to go on and make my primary care visit online on my phone. Just those simple things are so beneficial and helpful. And then really, talking with the patients, getting our physicians involved in the patient experience. They want to provide the best care. I have yet to meet a doctor that says, I don't care how the patient feels. Everybody, is so dedicated to our patients, and I feel that we're making great strides in coming together from every angle to make sure that we're doing everything we can, and I know that that's only going to improve as time goes on. So a lot to be proud of over the last year. I want to touch a little bit on AI. Artificial intelligence, because I don't know about you, but this last year for me, AI has just taken off, and it's not only on our cell phones and social media, but it's also in healthcare. Can you talk a little bit about some of the advancements we've made in AI over the last year?
Absolutely. I don't think you could go to any interview without talking about
Exactly.
AI at this point. AI is definitely coming into the medical realm. And the question we really have to ask ourselves, are we going to be on the forefront of that, or are we going to wait for others? And I will tell you that physicians and APCs, this is an area that they desire to be a part of. So a couple things that we're doing here at Marshfield Clinic is, number one, some people may be experiencing better patient care because they are doing a face-to-face interaction with their patients today. So we've invested in DAX, which is an ambient technology, meaning that it is listening to the conversation between you and your provider. It sits on the phone or it sits on the computer. Your physician or APC will let you know that they're doing that. They're going to ask for your consent to say, I have some technology that's going to listen to us. Are you okay with that? So one, we always make sure that the patient is aware of what's happening and that they're okay with it. Why are we doing it? It allows the patient and the physician to be face-to-face. I think I've received much feedback of my provider was actually behind the computer really trying hard to make sure that they're getting all the notes in.
Right.
They're typing. Sometimes the room situation is where your back is completely to the patient. It doesn't lend to that experience that people are looking for. They want a human interaction. They want to know that their provider is thinking deeply of their condition and that they're there for them in that moment.
Right.
We didn't go to medical school and to PA school and NP school to document. We went to treat patients. So we want to bring that interaction back. So with our DAX technology that we've been using, we did see that our patient experience scores in those areas actually improved. They saw that on the Sanford end as well, because patients are saying, oh, I'm having this face-to-face interaction. I feel focused on and cared for. Our providers are also stating the same exact thing. There's this time that we call pajama time that we look at for our physicians, meaning when your workday is over, how long are you spending documenting what happened throughout the day? We found that with DAX, we were able to decrease that really significantly by a few hours. That means all the world to your physician cohorts and APCs. It's time for them to sit down, have dinner with their family, to recharge so that they don't go through burnout. That is something that is very real today in healthcare. So we want to make sure that we're taking care of the care providers that are then taking care of patients.
Right.
So not only are we seeing better in our pajama time, our patient experience, we actually are having providers see even more patients because that cognitive burden of putting that note together has been removed. They are now the editor of the note. And then I've had providers say, you know what, that conversation, I didn't remember this one detail, but it captured it in the note.
Yeah.
So we're more accurate, we're more intentional, and then the patient experience has also improved. So we have seen a great improvement with the use of DAX. Even more exciting, which we've announced just last month, is that we are going to be pivoting to use the Cerner CAA, which is the Cerner AI agent. For DAX, we were only able to use that for 300 of our providers. We have 1,400 in total. So it was very selective in who could use it, when they could use it. Over the next month, we will be expanding that to all 1,400 of our providers.
That's wonderful.
It is. And for healthcare systems that are investing, I looked this up, less than 5% are offering more than 300 people or 500 people to use the technology. It is the investment on our end to say that we're dedicated. We want to make sure that you're well taken care of to our providers so that they can spend more patient time where they want to be and where they enjoy.
Right. I think that is absolutely spectacular because to your point, they want to be with their patients. The burden of having to dictate the notes. I mean, these can be very long notes, and depending on how many patients, 20, 30 patients a day, that's a lot of time. So that is a wonderful example of how AI is doing some great work for us. So it's exciting to see where the future holds. Talking a little bit, when we think about a doctor, I believe most people assume that they receive the same training as everyone else. If it's MD, they've all had the same training, but that's not necessarily the case. We know that physicians can also become board certified. Can you tell me what that means and how we could compare being board certified and not board certified to other health institutions?
Absolutely. So board certification is really important in physician realm. It is the standard, meaning that you have done testing, whether it be verbal or in paper form, to state that you have met a certain criteria for your training program. Most physicians do their board certification anywhere from 1 year to 5 years after their training, but it is a requirement that we have in Marshfield as well as Sanford to be board certified. I think even more important is, and to note of, is our fellowship training as well. Fellowship is, I'll take a step back. Residency can be anywhere from 3 years to 6 years, depending on what your scope of medicine is. Then there's people that go into additional training. So I'm going to use an orthopedic surgeon, for example. General orthopedic surgery residency program is about 5 years. In Marshfield Clinic, we have multiple subspecialty, meaning that they went back into a surgical program to do anywhere from 1 to 3 more additional years to do that particular scope of medicine. So hand surgery, your hand surgeon today are all fellowship board certified, meaning that they went back to training to learn how to do that very niche skill set. Or your joint surgeon went back to fellowship to do that very small area. Our gyne subspecialists, they've spent 3 additional years on top of the 5 years of training they already did to do that scope of medicine. So we want to offer to people the best of best. If you're going to have surgery, you're going to have it done by the best folks that we can recruit. So that fellowship component to me really makes the difference. It's the dedication and training to get that subspecialty certification.
Which I think is what makes Marshfield Clinic so unbelievably special, is not only is it difficult to recruit into a rural area, but we're also requiring the board certified physicians, which to your point is the best of the best. They've had unbelievable extensive training, and it's something incredibly unique for our area to have, and something we really should be incredibly thankful for.
Absolutely. I think a lot of people assume that everyone just did residency, but majority of our physicians have also done fellowships. And like I said, for somebody in the surgical field to have spent 5 years and 3 additional years.
Right. You're pretty dedicated.
You're pretty dedicated and you're pretty good. I think that's something that I think is really special about Marshfield Clinic is that dedication and honing in making sure that, again, that we're offering to patients the best best surgeons, the best consultants that we can possibly get.
That's wonderful. So I think my last question here is, people sometimes say that Marshfield Clinic is not the same that it used to be in years past. You know, we've had a lot over the last years with, COVID and trying to adjust from that and the transitions, from Marshfield Clinic to Sanford, and just a lot going on. It hasn't been easy in healthcare, and I don't think for anybody in the nation. I think we can all agree on that. But from a patient perspective, how would you say that access has improved? I think that's been the biggest concern people have had, is it's been hard to get in to see my doctor or a doctor for a specialty. And what do you think patients are seeing today that is making a difference, that we're starting to shift into saying, you know what, we're doing pretty dang good, and we're getting back to where we know we can be, and we're going to continue to advance as we move forward?
Absolutely. So I would say patient access is one of the most foundational things that we work on. We do have a council called SPAC. I think people have heard that more than a few times. So that's the System Patient Access Council. That's where we have all of our leaders come together, and we are actively looking at daily. What does the access look like? When is that next appointment? When is that available? When have we met certain criteria to open up more space? When do we start recruiting for someone else, because it looks like it's taking a little bit too long to see these folks? So what I would say is that dedication and honing in of having all of our leaders dedicate to that. We have a nice grid and also dashboards that daily tell us what's going on. What does the white space look like? Meaning, how much space does a provider have to see a patient who maybe calls in today? What does the third next appointment, that's the trajectory that we look at, is if you are a patient and you call in, if you're that third patient to call in, when would your appointment be? Right. You might be super lucky and call in first thing in the morning and they happen to have an open spot, but we want that consistency that if patients are calling in, they too can get in. Our goal would be to have same-day access. We want to get there. It's going to be more recruitment that helps with that, and also looking at and honing in on our schedules. Our providers over the last 2 years have worked with us in their templates, in giving freedom and access to help build in things. And this is kind of where our APCs, our advanced practitioners, help us. They help with access too. They're a pivotal part of the care that we deliver today, because they can help bring some access, but also work with a physician as well. So we've honed in on our APC recruitment. We're honing in on our schedules, and making sure that patients, when they call in or online, that they have availability. The other thing that we've changed, and I think this changed for everyone post-COVID, more and more people want to have online appointments. Especially in behavioral health. Sometimes people seeking behavioral health needs don't necessarily want to walk through the doors or come into an office, but they're okay to receive that care if they're at home and their provider can meet with them online. So we really pivoted our behavioral health platform, and it has worked phenomenally. We see patients all throughout the state. One of the big things that we're hearing is that pediatric and adolescent area really needing counseling and behavioral health, and we're able to fill that need not only locally, but throughout the state of Wisconsin. So I would say we have changed from where we are. We're listening. We want to make sure that we're meeting the needs of our patients, not only just here, but throughout the state. We know that we can be a change maker here. So yeah, a lot of things have changed. I have not gotten as many letters about not getting in.
Right.
So I take that as a good sign that people are getting in to see their providers, and we're looking at it every day.
Absolutely. I can attest to that. It's daily conversations and doing everything we can to get our patients in, and get those phones answered as quickly as possible. Tremendous work is being done. So I just want to thank you so much. I know you're incredibly busy, for taking time to meet with me, have this really important conversation. I think, over the last year, personally, I have thoroughly enjoyed the journey we're going on to being one of the best rural health systems in the nation. And I appreciate your leadership and Dr. Horniman's leadership and everyone around us that's working very hard to make Marshfield Clinic the best in the country. So, and thank you so much for joining. Until we see you next month, stay well, my friends.